Sigal, there is a new strain or a new variant. The consensus seems to be, as we were just hearing, that the vaccine will remain effective against it. Does it change in any way the plan and the timeline for a global rollout?
So the rollout is going to work, whatever it is. Everyone is planning, working really hard on the operational side and starting to give the vaccination out to as many people as possible, starting with the elderly ones, the healthcare, frontline workers, etc. I can't say for sure, and we don't have full proof that those new strains will be fine under the vaccine. We hope that we do not need, and that the world will not need to have a new vaccine, and that Pfizer will not have to re-engineer the vaccine and start another rollout. So we need to have more information. We're looking out for it. I do feel that the world is trying to calm down everyone and say everything is going to be fine. We have to continue, but we need more information about this strain. As it looks now, it seems that it's going to be okay. There is no certainty. So we need to continue to roll out, and it's working. There are going to be areas where it's going to be more challenging and areas where it's going to be very organized and disciplined. It depends which area in the world you're looking at.
Mm-hmm. Okay, so in terms of the logistics around the rollout, what are some of the key milestones that need to be hit in the rest of 2020 and in the first half of 2021?
So first of all, you have to look at different countries. If you look, for example, at Hong Kong and Singapore, the biggest challenge is that there is no social system that has clinics that are affiliated with affiliations between GPs and patients, like in Europe, in the UK, France, the Netherlands, Belgium, etc., where every person has a GP clinic that's been following their families and their children and their parents for many, many years. They know each other and they trust that doctor, and they will go and be able to be vaccinated through the system that they already know. And in a lot of other countries, like in Asia, for example, you have very disciplined people. The organization around the sick people is unbelievable. You see very good results in Singapore and in Hong Kong in dealing with the COVID-19 situation. However, I believe that the vaccination and the rollout is going to be more difficult because you don't have those infrastructures of relationships with GPs, with doctors, and it's going to be more complicated. I do believe that Europe, although we have the Brexit on one side and this travel ban into the UK, for the vaccine and for the purpose of getting people vaccinated, the whole world is going to collaborate, and we will see those transportations and the operational side working well, because no one in France or in Belgium wants the UK not to be vaccinated. So we're going to see operational solutions, deals, and we believe that this is going to be rolled out as soon as possible and faster as the countries get used of rolling it out.
So you operate in over 90 countries, right? What are you hearing from the ground as we continue to try to put into effect this vaccination campaign, the largest in history ever? What are the biggest logistical challenges that you're seeing?
So I think that there was an underestimation of how many people would want to get vaccinated very quickly. There was a trust issue that was on a big topic for a long time. And suddenly when the vaccines got there, this instinct of people that actually want to go back to normal life and really want to get vaccinated got very, very strong. So you have a much bigger demand than what was expected. And younger people, healthy people are calling, reaching out to the NHS, trying to bypass lines. People really want to get vaccinated. So it's getting a lot of vaccines in, and the rollout has to be very fast. So getting clinics organized, and it has to be very structured. If I look at the UK, it wasn't very good in getting the COVID situation under control, not very disciplined. A lot of sick people stayed at home, were recommended to stay at home, weren't monitored too closely, whether they were going out or not going out. Quarantines were not strictly monitored enough. So will the discipline kick in when we speak about rolling this out? Still and yet to be seen. But the people really want to get vaccinated. So there's going to be a big push and maybe some social unrest if it's not going to work very efficiently.
We've seen huge changes when it comes to the way that people go to hospitals or really liaise with the medical professionals, especially when it comes to the boom in digital services, right? What are you seeing unfold, especially as you operate in mainland China, different cities in mainland China?
So the unbelievable has happened. The most improbable situation has occurred with this pandemic, which has taken a terrible toll on the world from an economic and a human toll, obviously. However, there's a good legacy that I believe is going to come out, and we see already its foundations right now out of this pandemic, and that is virtual care. That is care on demand from the safety and the comfort of people's homes. So virtual care has grown tremendously. Different digital health applications now can monitor and engage with patients about their healthcare and help them prevent healthcare or treat themselves in certain situations and remotely speak and engage with their doctor and specialist. This is here to stay, and that is a revolution in how healthcare is consumed and provided. It's going to be more affordable, more accessible, and more sustainable. So people will get more healthcare at a better quality. On the other side, if you look what's happening, we will see more artificial intelligence coming in and more engagement and more analysis and personalized treatment through artificial intelligence and digital health capabilities. You mentioned China. China is really at the forefront, and with its commitment to serve and better serve the Chinese people and improve their healthcare infrastructure without building this very expensive and inefficient huge hospitals and clinics and infrastructures as we see them that are not sustainable in Europe and specifically in the US. They've turned and developed very strongly their digital capabilities and their artificial intelligence capabilities. So if you want to look who's going to win the game probably and who's going to be at the forefront, it's absolutely China. Will Chinese technology and capabilities go into the world? That's another question. You have the US who works really hard to make healthcare more accessible, more sustainable, more affordable through digital health and artificial intelligence. You see Europe waking up, but now struggling with this pandemic. So it's a race, but change is here. It's happened. It's good, and it's not going to go away. People and patients we see on the ground really like to use virtual care and got used to it.